very much for agreeing to help us with this. This is my colleague, Dr. Caroline Fertleman.
Hi.
I'm Dr. Raine. We're both consultants and we're both examiners for this postgraduate paediatric exam. So just tell me a little bit about what made you bring your child to hospital. What happened?
He had a seizure, so we phoned the ambulance and they transferred us to Northwick Park, but he had chickenpox, so we transferred here.
Okay, so I think that was because there was no cubicle and he had to come somewhere with a cubicle. And the chickenpox was how long ago?
It was nearly 2 weeks ago.
Okay. And how long was he completely unresponsive for?
I would say 10-15 minutes.
Okay.
And
yeah, go on,
so,
please.
and he was locked out, and he started speaking after 1 hour.
Okay, so he was completely unresponsive for 10-15 minutes,
Yeah.
and really not himself
For 1 hour.
for 1 hour. And after that, he sort of woke up. And how is he now? Is he back to his normal self now?
Yeah.
Talking and chatting. And did he have a temperature at all?
When he had a seizure.
He had a temperature when he had the seizure?
Yeah, that we have been thought he had a temperature.
Okay. Has he ever had a seizure before?
No.
No. Okay. Did he complain about the light bothering him at all?
No.
Okay. Did he have any skin rash at all?
Never.
No. Did he complain about his neck being painful or stiff? No. And when he was born, were there any problems when he was born around the time of birth?
He had, I think, an infection. It was so high, he turned blue.
Okay.
And then they put him in incubator for a few days.
Do you know what sort of infection he had, or?
No, they didn't tell us.
But they didn't say he had meningitis or anything like that?
No. He just turned blue, and then we called the nurse, and they took him to the...
So he got some antibiotics?
Yeah.
Okay. And how's he developing? How's he doing at school?
He's a bit slow compared to his other colleagues, but he's fine.
Okay, so the teacher's happy with him?
Yeah, in
Does he need any special help?
Sometimes, especially in maths.
Okay, but okay. And are you and his dad related at all, like
No.
cousins? No. And has anyone in the family got epilepsy, or who's got epilepsy?
From my husband's side, his sister.
So your son's aunt.
Yeah.
Anyone else, or
No.
no? Okay. And he didn't injure his head or bang his head or anything
No.
like that?
Not while he was at home.
Okay, okay. So I understand that he's had lots of tests, including a lumbar puncture.
Yeah.
He's going to have an EEG, but he's not had that yet.
Mm-hmm.
And he's had an ECG, a heart rate and ECG that I think was normal.
Okay. And you said the LP was negative?
There were no white cells in it, and it's been sent for further testing. Is there anything that you want to add at all? No. Is there anything that you want to ask?
Do we check on immunisations and development? Just to pick up a bit on Mum was saying he was a little bit.
So you said that he's a little bit behind with his maths. You know, with his development, did he sit at the normal time? Did he walk at the normal time? He talked?
No, I didn't have any problems.
No problems.
Yeah.
Okay.
So the problems are sort of a bit more now in this last year, or just?
No, his teachers telling me that he had a problem last year, but they didn't follow it up. But this year they start to give him extra lessons.
Right. Okay. So it wasn't with it's understanding maths concepts. You said mostly.
Yeah.
Right. Okay.
But when he was me, he doing fine.
Okay. And does he read books? Does he read himself?
What do you mean?
So does he sit down and read a book?
By himself?
Yeah.
No, he's like a typical boy. He likes to jump and play. He's not a test.
And he's 8.
He's 6.
Oh, sorry. Apologies. No, that's why he's not reading books.
And he's fully immunised.
Yeah.
He's had all the usual vaccinations.
Yeah,
okay.
So one other question is: does he ride a bicycle?
Yeah.
Without stabilisers? With stabilisers. And what about swimming?
I have to help him.
Okay. It's just swimming. Okay. Anything else you wanted to ask, Joe?
No.
I suppose some of it might be the impact on the family. Quite often we might sort of ask a bit that the students, or the trainees often ask about that. I mean, how
you
they
must have been
it.
very, very scared when it happened.
Yeah, I was shouting, and I didn't know what happened exactly. Just screamed and shouting, bringing water and throw it on him.
Okay. Have you ever seen, you said his aunt has fits.
I didn't see
Have you ever seen a fit before?
No.
So it must be very, very scary.
Scary.
And who else is in the family? You've got, Mum was telling me on the way in that they're originally from Egypt, her family, and her husband too. And you've got an older child who wants to study medicine.
Yeah, my daughter.
A daughter. And there's just the two children.
No, I have 4.
Okay, and
two girls and 2 boys.
Right. And how are they doing generally?
They are fine.
They're fine.
Okay, so we've heard the history, and the question is, what would you expect and what you wouldn't? So I think, firstly, one wants an introduction and an open, friendly introduction. Secondly, and I love this statement, and I never miss an opportunity to say it, which is Sir William Osler's statement: listen to the patient, they're telling you the diagnosis. So I think it's important that, as they say, there are closed and open questions, and you listen to what the patient is telling you. You don't block the parent, you don't block them off, that you're a good listener. I think that...
I think also this mother is actually quite clear, she's quite succinct, she didn't go on and on and on, and even though she was worried because she had an accent, actually she's very clear. So I think this is a perfect sort of an example of a parent who's actually able to tell the story quite clearly. So she's fair.
Absolutely. I think it's a very typical London case. So I think in terms of the acute situation, obviously they need to know about the chickenpox, that goes without saying, about asking about fever and a rash. I also think it's...
and including the chickenpox, Joe, I would say that they need to know that their cerebellar and pneumonia consequences will be the main 2 consequences after chickenpox. And
the timing here is about right, the 2 weeks. Because that is when you can get a sort of a chickenpox encephalitis, which is usually a cerebellar problem, ataxia and so on, which doesn't really sound like that sort of picture.
Like what he's had.
And so it could be that the chickenpox is completely unrelated, and this is just epilepsy. And you always have to think, could this be one of these treatable things like a meningitis or an encephalitis? I think you've got to ask. We know. So they've got to ask that, and we know that that's been excluded by having a negative LP. So they should ask about neck stiffness, photophobia, the classic. And then the sort of the nature of the fit, which has to be elicited in detail. I always find it very useful to know whether they're drowsy post-fit.
Which he was.
Which he definitely was, which makes it much more likely to be a fit as opposed to some other episodes.
And also doesn't particularly fit with an absence seizure either. Because you do get new onset absence seizures exactly at this age group, 6-year-old boy at school. So, but this doesn't sound typical of an absence seizure to me. They're not post-ictal for 45 minutes after a prolonged absence seizure.
Actually, what we didn't ask about, and what I should have asked about in more detail, was his mum said he didn't shake and that he didn't go blue. But what I didn't ask about was whether he was tonic. Because it might be that he was, and that was a sort of fit he had. But it does sound like a generalised fit.
It does. I'll look this up while you're...
And then there's the usual, head injury, birth history, developmental history, consanguinity, family history. So that's the history bit of it. As far as the management planning is concerned, we know that his bloods were normal. I think his CRP was in the teens. But very importantly, we know that the LP showed no white cells at all, 0. So he's not got meningitis. I think it was, I'm not sure of the exact timing, but let's assume it was done prior to treatment.
Yeah, I mean, just looking through the history again in the notes, there is nothing about him being stiff or there being, so there's no movements and there's no tonic phase. I think he was just collapsed from what I can gather.
So I think in terms of treatment, even though there's no history of fever, I don't think it's unreasonable to give him ceftriaxone until we have the 48-hour blood cultures, to give him acyclovir, and that would be at the neurological dose rather than at the standard dose, until we have the herpes PCR back on the CSF. And then I think it would be reasonable.
And so can we just talk about some of the criteria for pass-fail? So, because I think it's quite easy when you stand at these stations that we decide at some point. We can do that.
What I was going to do was just very quickly finish the thing, and then we can decide about the different. So I would give someone like this who's had a sort of a 10 to 15 minute fit midazolam to have at home and teach them basic life support. An EEG is pending. I think whether or not you do an MRI depends on. No, unless the EEG shows any focality. I mean, he is back to normal.
Although it is interesting that he's finding school difficult, but maybe that's, that might be a red herring, that he's not doing. Mum had said he's not doing quite as well at school compared to his peers.
So I think it would be useful to talk to the teachers to find out a bit more about that. And then he'd need clinic follow-up. So the criteria for... Shall we talk firstly about clear pass versus pass?
Well, I mean, I suppose clear pass is to get the whole statement. I think they also, which we haven't quite talked about, is how it's impacted on this family, having a child in hospital. I think also the other thing for me, and this is about being a real-life person who's aware of what's going on, is why he wasn't admitted to the first place he went to, because there wasn't a cubicle. And I think there has to be some understanding of why people end up in different places and what the reasons are. So I think for me that would be in the clear pass category, that they've acknowledged that they're away from home, they're quite far away from home, they went into a different hospital, they got transferred here, and that can all add to the sort of...
Family disruption.
Yeah, the family disruption, yeah.
Okay, so I think to get a sort of a clear pass, I think it'd be important to have asked about things like, was there any neck stiffness, for instance?
So excluding meningitis,
Yeah, I think it'd be important to know about the fact that there's a standard dose of acyclovir and a higher neurological dose if you suspect encephalitis. And it'd be important to sort of discuss things like midazolam and
how you manage
supervision of someone who may have epilepsy, like the things we talked about. Okay, now in terms of anything else that you want to differentiate between clear pass and pass?
I do think know why they've ended at a particular hospital A rather than B hospital, and I think also the about whether there's something else going on. So having picked up about the fact he's not doing maybe quite so well at school, and they obviously have other children who are very bright because one of them's applying to do medicine. So there seems to be a bit, and he's October in the year, so he's an older child in the year, he's not a young boy in the year. So, and that would tie in, I think, with if there's any sort of consanguinity and sort of any rather subtle issues with learning. So I think that all goes in the clear pass, and I expect some, as you go down the categories, you'd have a certain percentage or a certain number in the pass, and then certain things in the fail that So if they don't exclude, if they don't mention this, there's chicken pox, they don't mention this as a fit, if they don't mention meningitis, then that for me would be a bare fail or clear fail, depending on how they answer it.
So to get a clear pass, you need to probe a little bit more into how far behind he was at school.
Yeah, I think so.
So I think we're fairly clear on the clear pass versus pass, and just to sort of elaborate a bit more about the fail, the fail criteria. I think they would need to distinguish between how long the fit was and how long the post-ictal episode was.
That's very
so I think that's a pass-fail thing.
Yes.
I think not to ask about how he's doing at school is a pass-fail thing.
I agree.
The neck stiffness is a pass-fail thing.
What about immunisations? I mean, this is...
I think that's a part of any history.
Yeah.
I think that you've got to treat the treatable.
Yes.
So I think it was. Is it a pass-fail thing? Well, yes, he did have a fever. Apparently, he did have a fever, according to the ambulance people. So he had to have antimicrobial. So that would be a pass-fail thing. I think talking about the care of a child with epilepsy who may have a second fit is a pass-fail thing.
But I do think there's a difference between, you know, knowing the neurological dose of IV aceclidine. That for me is the difference between a clear pass and a pass.
Yes,
I don't think it's a fail criteria that you don't know the difference between those two doses.
No, I agree. I think they have to be aware that you can get post-chickenpox encephalitis, and it's typically in a ataxic type picture, not this sort of picture.
And maybe to mention that there's also pneumonia, although I don't think this fits with it at all, but that might be in the
But I think the post-cerebellar ataxia thing, post-encephalitis, let me start again. The cerebellar ataxia that you can get about 2 weeks post-chickenpox is a pass-fail thing, because I remember learning about it as a medical student.
Yeah, no, I completely agree. I agree with that.
Anything else on the pass-fail?
I mean, I suppose there's something about how they treat the mother, and if they just, you know, use lots and lots of closed questions and don't allow the mother to you know, I think there's something which sort of says it here, doesn't it?
Sort of overuse of jargon.
Overuse of jargon, lots of closed questions, not very hasty, and doesn't actually ask the mum, which you did at the end. Is there something else you want to tell us, or there's something about allowing the parent to ask them questions?
I think that's very, very important. I think that is a pass-fail thing if you don't give the parent the opportunity to ask a question.
Okay.